Hello, dear students. How are you doing? I hope you are doing great. Here we are again in a new reinforcement and review session. Today, we are going to do the following items. Vocabulary. In vocabulary, we will focus on health vocabulary items. And then, functions. In functions, we will talk about asking for and giving advice. And listening, you will listen to a dialogue between a doctor and a patient, and then I will ask you to do a task related to it. Reading comprehension is going to be a text about healthy and unhealthy habits. And then writing. In writing, I will ask you to write a letter of advice, and of course, I will show you how to do it. Let's get started. Vocabulary. Now, what's the matter with me? It's a oh my god. Oh my god. What's the matter with me? I've got a it's a toothache. And now it's fever, temperature 38. It's a headache, right? The vocabulary we are going to revise are related to health problems. Now, look at these pictures. Look at the boy. What's the matter with him? Yes, he's got a broken leg. Look at the next one. Bruise, asthma, or a headache? It's a headache. Yes, exactly. Headache. Next one. Yeah. What's the matter with the boy? Has he got an earache or a toothache or a headache? Exactly, that's right. Exactly. A toothache. What about the next one? Yes, exactly. He's got a stomachache. And look at the next one. Broken arm, a fever, or a bruise. He's got a fever, that's 38. What about this one? Measles, or a cough, or a faint. Yes, he's coughing. He's got a cough, that's right. And what about this? Yes, this is a throat. Yeah, she's got a sore throat. She's got a pain in her throat. That's a sore throat. And this one? A cold, a broken leg, or asthma? That's exactly, yes, it's asthma. And the last but one, earache, broken leg, or a faint? He's got an earache. Yeah, a pain in his ears. And the last one, what's the matter with that boy? Yeah. Earache? I don't think so. A flu? No. That's a backache. A backache. So a backache is a pain, right, in the back. Now, I hope that we have reviewed the health-related vocabulary items. Right. Okay. Now, let's move to functions. In functions, we're going to talk about how to express statements that are related to asking for and giving advice. Now, here we have asking for advice. I want you to try to fill in this chart. For example, what should I do? This is asking for advice. For example, oh my God, I have a toothache. What should I do? Right? It's an example. If I ask you, what should I do? You may advise me, like, I advise you to see a doctor, right? Or, why don't you see a doctor? Or, that's what you have to do. So try to fill in this chart. Can we do it? Let's go. Here we go. What do you advise me to do? Next one. What should I do? There's another one. If you were in my situation, what would you do? And there is another one. What would you advise me to do? Another one. What would you do if, etc.? Another one. Do you think it's a good idea if I? So here, as you can see, there are a lot of statements we can use in order to express asking for advice. Given advice, again, we have a number of sentences, of expressions you can use in order to give advice to someone. For example, if I were you, I would see a doctor, for example. You should see a doctor, for example. You'd better see a doctor. Remember, here you'd better or better not plus bare infinitive. Why don't you see a doctor? I advise you to see a doctor. Maybe you should see a doctor. Now let's move to practice. Now that we have done and seen these statements of how to express advice and how to ask for advice, let's do a practice. Right, your task is the following. I want you to complete the following exchanges with the appropriate expression from the list. Now look, we have you'd better. What do you advise me to do? What about using? Why don't you, etc.? What should I do? Do you think it would be a good idea if? But first, have a look at the picture. Yeah. Maybe he has a headache. Exactly. What do you advise me to do? If I were you, I would take an aspirin and have some rest. By the way, we have other expressions, as I said. For example, if you were me, what would you do? Right? Now let's move to the second picture. Have a look at the picture. What's the matter with her? She has spots. She has spots on her face. And now, her name is Ahlam, by the way. Ahlam is asking her friends, Hiba, Ala, and Mehdi. Ahlam, I have spots on my face. What is the expression? What is the question that she's going to ask Hiba, Ala, and Mehdi? So I have spots on my face. To get rid of them. Exactly. What should I do to get rid of them, to get rid of those bad spots? Maybe those spots are embarrassing her. Hiba. There's another expression, of course. Yes? Yeah, you'd better avoid fatty food. Yeah. Ala, some natural types of soap. It's a question. Yes? For example? Exactly. What about using some natural types of soap? Why don't you see a doctor? Great. Now, we're going to move to do something different, which is about healthy and unhealthy habits. Right. Here, we have different examples of unhealthy habits and healthy habits. For example, eating between meals, washing hands before and after meals, brushing one's teeth, taking showers regularly, staying up late, eating junk food, exercising regularly, sleeping a lot. Can we do the task? For example, number one, eating between meals. For example, you eat between lunch and dinner, between breakfast and lunch, right? Yeah, it's a bad habit. It's an unhealthy habit. Eating between meals is bad, right? If you want to keep fit, please try to avoid it if possible. Next, sleeping a lot. Next, eating junk food. Again, eating junk food. We talked about it last time. Remember? The danger of eating junk food. It was a reading activity, by the way. Staying up late. Yeah. Teenagers, please do not stay up late. Bad for you. Healthy habits. Washing hands before and after meals. Brushing one's teeth. It's a healthy habit. Taking showers regularly, of course. And the last but not least, exercising regularly, doing a sport, physical activity. So these are different ways that are related to healthy and unhealthy habits. Task, right? Okay. I want you to just fill in the gaps to complete these sentences with, of course, brush their teeth, sleep a lot, exercise regularly, eat junk food, eat in between meals, and staying up late. Let's read together the first sentence. Salim becomes obese, very fat, because he brushes his teeth? Of course not. Because he sleeps a lot? Because he exercises regularly? Because he eats junk food? Let's see. It's exactly because he eats junk food. Don't eat junk food. I know it's tasty, but please don't do it. Right. If you want to keep fit, you should exercise regularly. Is right. Number 3, eating between meals will surely affect your stomach, of course. Maybe you will have a stomach ache very often. Next, parents should teach their children how to do what? What is the appropriate sentence? Yes, to brush their teeth. It's a very good habit. Can we move to another activity? Okay, now let's move to listening. As I told you, you are going to listen to a dialogue between a doctor and her patient. Her patient's name is Mr. John. What I want you to do, I want you to listen to the dialogue and try to do this task. For example, what's the patient's problem? Earache or headache. Number 2, the patient's pain is behind the eyes or behind his ears. You just listen and concentrate on these questions. Not that difficult. Number 3, the patient doesn't wear glasses or the patient hasn't got free time. Number 4, Mr. Jones needs an eye test or a computer. Can we start? Let's go.
Hello, Doctor.
Hello, Mr. Jones. What's the matter? Have you got earache again?
No, my ears are fine, but now I get headaches every day.
Headaches?
Yes, I'm in a lot of pain here behind my eyes.
Behind your eyes? Well, do you wear glasses?
Glasses? No, I can see well. I usually read in my free time.
And what's your job?
I work on a computer in an office.
You use your eyes a lot and you get headaches. You need an eye test.
An eye test? Really?
Yes, reading and using computers can give you headaches. Can you take exercise in your free time?
Well, yes.
Good. Exercise can help. Come and see me again after the eye test.
Okay, Doctor. Thanks.
Okay. Now that we have listened to the dialogue, that's correct. Now show me. What have you done? We said, first question is, what's the patient's problem? Earache or a headache? Exactly. It's a headache. Number 2, the patient's pain is behind the eyes or behind his ears. It is behind the eyes. And the patient, Mr. Jones, does not wear glasses or hasn't got free time. He does not wear glasses. And of course, she will advise him to wear glasses. And the last one, Mr. Jones needs an eye test. Now, let's move to reading comprehension. Now, in reading comprehension, we are going to read a text which is about health is wealth. What do you understand from the title? Yes, the text is going to be about the importance of health, of having a good health. And look at the pictures. Number 1, look at this picture. Yeah, there are fruits and vegetables. Very important. This is what we talked about last time. And sports. And of course, one of the good habits, the healthy habits, sleeping. Enough sleeping, not all the time. All right, now let's read the text. To be healthy is the most essential need people are striving to achieve. But how can we stay healthy? Eating a healthy and a varied food is a key answer to such a question. This means that we should eat different types of food, such as vegetables, fruits, dairy products, and fish, because they contain lots of vitamins. In addition to this, we should avoid unhealthy food like junk and packaged food. It's true that they are tasty, but they are harmful too. Drinking water and natural juice instead of soda, which is full of calories, is also desirable. Paragraph 2. Practicing sports regularly, at least 3 times a week, has lots of benefits. Thanks to it, we keep fit and strong. Sports helps weight loss, and improves cardiovascular fitness. Moreover, it reduces depression and stress. Early to bed, early to rise makes a man healthy, wealthy, and wise. This means that sleeping early and getting up early have a number of benefits. Sleeping early improves concentration. It makes us feel great and more productive. Science has shown that there is some truth in this. However, staying up late and waking up late lead to dizziness and lack of concentration. Having read this text, let's do some comprehension questions. Okay, now, are these statements true or false? Justify your answer. By the way, whenever you are asked to justify your answers, please do. Because just don't say it's true or right, it's false. You have to justify your answers. Now, number one, we should eat junk food because it is healthy and tasty. Does the text say this? Of course not. This sentence is false because we should not eat junk food because it is unhealthy. That's a key word in this text. It is advisable to exercise every day and on a regular basis. Of course, no one can deny that exercising is very important, essential. It's a must in order to keep healthy. But according to the text, is it every day or three times a week? So this sentence is not correct according to the text, because the question, according to the text, are these statements true or false? Next one. Sport has very little effects on the cardiovascular system. Sport has very little. It means that it doesn't have big effect. Of course, again. So the three sentences are false. So sport has lots of benefits on the cardiovascular system. Now, there is another part in this reading comprehension text. Answer the following questions from the text. Number one, what are the different types of food we should eat? Junk food? Fast food? Pizza? Pasta? What does the text say? Yes, vegetables, fruits, dairy products, and fish. That's right, you're great students. Next, why is sleeping early good for us? Why? We said it, we talked about the importance of sleeping early, and it says it improves concentration, it makes us feel great and more productive. What are the consequences of staying up late? What are the consequences? We talked about something which is concentration, fatigue, etc. Yes, it leads to dizziness and lack of concentration. Lack of concentration, absence of concentration. Of course, how can we concentrate and we stay up till 3 o'clock, 4 o'clock in the morning, maybe chatting with friends on different social media or whatever? Find in the text words that mean almost the same as. A word in the text which means important. It is? Exactly. Essential. Essential. Important. Powerful. In the text. Strong. Opposite to or opposite of weak. I'm so weak. But if you eat healthy food, good habits, then I'm sure that you will be strong, fit, and powerful. A word in the text that means delicious. Oh yeah, this is delicious. Moroccan tagine, so delicious. Moroccan couscous, so delicious. Delicious or tasty, exactly. What do the underlined words in the text refer to? They. Junk and packaged food. This one, it. Sport. Now that we have done this reading activity, Let's move to what? One more skill. It's writing. Exactly. In writing, I want you to read this letter. It's a very small, very short letter. Mrs. Fatty suffers from obesity. Read her letter and write a reply in which you give her pieces of advice. Let's read the letter. Dear friends, I've got a terrible problem. I'm always tired and can't sleep well or even concentrate on my studies. My big problem is obesity. I just can't stop eating fast food, soda, and ice creams. I feel so embarrassed at school and elsewhere. Could you please advise me? Fatty. Maybe she's fat. Why? Because she cannot stop eating fast food. We talked about expressing advice and different statements you can use in order to express advice. You'd better. Why don't you? But this is writing. That is to say, you have to respect some rules of writing. I have prepared a checklist for you. Have a look. These hints may help you. Use the expressions of advice, like, I advise you to. You'd better. Why don't you? If I were you, I would. You should. And when you finish writing, please check your punctuation marks, your spelling, your grammar, etc. Dear students, I wish you the best of luck. Thank you for watching. See you next time. You're great students. Goodbye.